Hello, everyone. Welcome to another episode of Dr. Plano's Plastic Perspectives. Today is January 10th, and I am Dr. Jeff Angobaldo, a board-certified plastic surgeon, otherwise known as Dr. Plano. Our plastic perspective today will be focused on hair loss, the causes, and the treatments for it. So we see a lot of our patients, males and females, both males and females, with hair loss. And it can be caused by a variety of factors. The most common for male apparent baldness as well as female apparent baldness is hormone related. That's why you see more males, because there's more testosterone in males in comparison to females. But that's called, the term is androgenic alopecia. Alopecia is just baldness. Androgenic is just hormones. And there's a big genetic component to this also. Other causes of hair loss that's not related to hormones is stress, illness, like you have a cold or something, you're just sick, pregnancies, something that's a massive change in your body is what I'm trying to get at. You can change your diet or medications that can cause hair loss. So those treatments for that is just kind of reducing stress, improving nutrition, eating a good balanced diet. That stuff really, and you'll see how you decrease the stress, whatever's going on in your life, a pregnancy, there's a big change going on, that will kind of almost auto-correct itself. One of the hardest ones is autoimmune. Just like autoimmune diseases are like lupus, rheumatoid arthritis, but basically your immune system attacks your hair follicles. And so with that, you're thinking more like autoimmune diseases, you gotta use steroids, topical, or pills, steroids that help calm the whole autoimmune process so your body's not attacking itself. And that's stuff that a primary care doctor, will do and help with. The other aspect is, hormone related issues, not just androgenic hormones, not the testosterone. We're talking about your thyroid hormone. So people with low thyroid can have hair loss. And that's all, when you're seeing your primary care doctor or a dermatologist, they'll do a full slew of labs to make sure it's not hormone related. Because if your thyroid is low, you're losing hair, your Synthroid or thyroid medicine will help regain your hair back. And then there's another cause, it's traction. The other cause of hair loss is just pulling your hair out. So that's usually due to stress or just people with tight hairstyles, those braids. So just, avoid really pulling the hair too much. And the other one that we see not too frequently is just scarring. Scarring like burns, they can heal, and it's those areas have reduced blood flow. So hair transplants work for all types, but this one might be one that it will still work, but the results are not as great as if someone wasn't scarred in that area, because scarring doesn't have great blood flow, and you need blood flow for survival of hair follicles. And nutritional deficiencies. So a lot of times, for all of our hair patients, we always recommend vitamin D, zinc, iron, biotin, because you got to feed your hair also. So the keratin in your hair is the same in your nails. So if your nails are strong, your hair will be good. And how do you know? You're taking biotin, you're taking your amino acids, you're taking all your minerals, your vitamins. But we're going to focus more on the most common aspect, which is testosterone and androgen related. And so what are the treatments for it? Rogaine is one. It's over the counter. And no one really knows how Rogaine works, but it causes kind of like an inflammation. So when you irritate an area, more blood flow go to the area. So you're bringing more blood flow because it's red and irritated, you're going to have more stem cells. That's kind of how Rogaine works, or minoxidil. But I use a different product for my hair, and it's called Revitalash. It's an interesting story because the person that found this I guess, the product 20 years ago or so. His wife had cancer and was undergoing chemotherapy, and with that, you lose your hair, and it's and what he noticed was that her glaucoma eye drops, she still maintained her eyelashes. So there was something in these eye drops for glaucoma that people weren't shedding and losing their hair with chemotherapy. So he found that product and created Vitalash. So it's been very popular for eyelashes. And then a few years later, he came out with eyebrow thickener with the same product, the same protein, which is organic. And what I use is their foam. So after I take a shower, wash my hair, I use the foam, and I use a comb to kind of like really kind of rub it in, I guess. So it works very well. And that's kind of the comparative for Rogaine, I guess you could say. The other thing that works very well for androgenic alopecia, hormone related, is Propecia. And it's normal medication by prescription. We always have to check some baseline labs before we prescribe. And it's usually done by a primary care physician. And it works by blocking the testosterone receptor in the scalp. So it actually works very well. But once you stop products like Revitalash or Propecia, what it does, it prolongs the telogen phase, which is the last cycle of life for a hair follicle. So once you stop these products, you wait a couple of weeks, you start seeing shedding of your hair. So it doesn't really, it just prolongs that phase, and your hair is not falling out while you're using it. So these are products that you have to use for a very long time. Hair transplant surgery is probably what we do the most of here for hair loss, for treatments. And we have a machine called a smart graft that harvests small little follicles from the back of the head, because the back of your hair rarely ever falls out. So we transplant these follicular units from the back to the front or the top part of the scalp, wherever someone wants it. I'm always a big fan, if you're going to do a hair transplant, really focus on the front if your temples are receding and you have hair loss, because no one really looks at the back of your head. I mean, you do when you're at the barber shop, but the majority of the time, people are looking at you, staring at your eyes, making eye contact, and you're looking at the front part of your head. So I'm always a big fan, if you got to choose which areas you would do, I always focus more on the front. But I use the follicular unit extraction, the smart graft, because it removes these hair follicles, and you're creating these little tiny holes that heal within 2 to 5 days. So there's no scars. There is scars every time you penetrate the skin, but there's no really visible things that you can see on patients. People heal quite well. And you can use hair transplant for the majority of all hair loss, not just testosterone related. The impact of hair loss will affect someone's confidence and self-esteem, both men and female. So we have a team here that really focuses on hair loss and the different treatment options for our patients. One of the things that we utilize to maintain hair, to decrease it falling out, we talked about the prescription for Propecia, we talked about the Revitalash that we use after showers. Revitalash also has a shampoo and conditioner. We have a Renaissance Nutrafol, which is basically a blend or a combination of some minerals, vitamins, botanicals, and amino acids, and biotin, which we need. You're basically feeding your hair, and that's key. Hair lamps are great. We have a red light. It's a diode. The ones you can buy online are LED red lights, and they work, but you have to use it every day. We have a diode lights that's red, that's a little bit more powerful, that you just need to do it 10 times and repeat it every 6 to 12 months. The hair lamp doesn't hurt. The application usually takes about 20 minutes. One of the things that really work very well is PRP and hair exosomes. PRP, it's been studied for a long time. So what is it? PRP stands for Platelet-Rich Plasma, and it's used for all areas of alopecia or thinning. PRP is really good, especially for the androgenic alopecia, hormone related. And it's really good for other forms of thinning also. Basically, you're drawing blood from someone and you're spinning it into a centrifuge. And so we're taking out a lot of the stem cells, the platelets. It's been shown that these platelets and growth factors and proteins help promote hair growth. I wasn't a big fan of PRP when it first came out 15 years ago until they came out with a study in our Applied Surgery Journal about 6 years ago. And they did a randomized study where they looked at one group had PRP, the other one had just normal saline, just a placebo. And in the study group, they actually found that the PRP group had thicker hair, new hair growth, and less hair falling out. So basically, I became a big believer in it afterwards. And they use PRP and stem cells for joints, orthopedic uses, wound care. There's a lot of different areas in medicine they're using PRP, but in our practice we use it primarily for hair restoration and maintenance. So how does it help? The PRP, it stimulates like more blood flow. It helps wake up those sleepy hair follicles. They're called dormant follicles. And it puts them into that active phase of growth. That's why you get new hair growth and thicker hair, because more hair is growing. And it also helps with inflammation. Every time someone has a hair transplant with our smart graft, we always recommend doing a PRP treatment a week before or even the day before, but it's always nice to do it a week before. And why is that? With the hair transplant, some folks can get post-transplant hair loss. So sometimes the area that we're placing these hair grafts, those hairs around it may fall out. It's temporary, comes back in 2 to 6 months, but who wants to have extra hair loss when you're treating hair loss? So the PRP helps prepare the wound bed so these grafts take, and also decreases post-traumatic hair loss and the residual hair that's there. So for me, that's part of our protocol, is to inject PRP prior to any hair transplantation. New things came out over the last year, and one of the things are called exosomes. It's a newer treatment. We're not drawing any blood like we do in PRP, and it can be used for a wide range of hair loss. All the different conditions and types it can be used for. It's still being studied. This stuff is very innovative and very new. It's very, I guess you could say, advanced and cutting edge. So what are exosomes? One thing they're not are stem cells. Remember, like PRP has some platelets, some proteins, some stem cells. Basically, exosomes are the kind of like the byproducts of stem cells. It's the lipids, it's the RNA, it's a lot of the bioactive materials that simulate like cellular connections and communications, which help simulate like hair repair. So these exosomes, really, they transfer these proteins, these RNAs, they're like signaling proteins that help basically say, we're going to start organizing this whole area. We're getting more density. We're going to reduce the inflammation. We're going to cause more hair growth, less hair loss. So it's just, it simulates collagen production. More cells are growing out of it. So it's amazing. Like I haven't tried it myself, but some of my staff here have. And we've been very impressed, because with PRP, we're doing it every 3 months or so with patients, sometimes every 6. Exosomes, 1 or 2 treatments, and they have more dramatic results. There's a little bit of a higher cost associated with it, but basically it works and it's looking really good and our patients are happy. So just so, I hate talking all the sciencey stuff, but the PRP basically has the platelets, growth factors, cytokines, but it doesn't have that RNA that the exosomes have, and other signaling proteins, things that like make things happen, you could say. And that's where the exosomes come in. So it's a great complement to any hair grafts or just doing exosomes by itself. But it all depends on someone's budget. It's a little bit more pricier than the PRP option, but they work similarly, but a little different. So that wraps up our podcast. Hope you learned a lot about hair loss. If you want more information, you can visit us for a consultation at drplano.com. You can call us at 972-378-3870. You can follow us on social media. And don't forget our holiday specials. Valentine's is here. We also have specials coming up for Mother's Day in a couple of months, so look out for them on our social media websites. Thank you.